Welcome to American Medicine Today. I'm Kimberly Bonati alongside Dr. Alfred Bonati. So, if you can explain the difference between general anesthesia and what you utilize is conscious IV sedation.
Initially, we start with general anesthesia. I always fear the general anesthesia because not only complications like respiratory consequences, sometimes cardiovascular, some other times if the patient remains too long in anesthesia, problems of stroke. So all these things always scare me, and always I was against somebody to put me to sleep. So if I don't want anybody to put me to sleep, why I will want to put to sleep a patient? One of my anesthesiologists, who is a really brilliant guy, he started to experiment with sedative medications. And then what we did is we initially numb with some type of xylocaine. Using that medication, we knew that the patient will not have pain on the skin. So if we introduce now the instrumentation deeper, the patient had pain. Initially, we thought that was associated just with muscle pain. But then we realized that was sensation from the fascia. So we numb the fascia. So once we numb the fascia, then we were able to understand that we can penetrate farther and get to the bone. But when we arrived to the bone, was also pain. Then we realized that the pain was because the periosteum is very sensitive. We numbed again the periosteum. So we put 3 little amount of injections, and maybe each one around maybe 4 or 5 cc's of xylocaine. 20 cc of xylocaine is very much tolerated for anybody. But we always have a question, can we touch the bone and see will be pain or not? Then we use some type of drill to touch the bone. To our surprise, the bone doesn't hurt. So we found immediately the possibility to do spine surgery without really doing anything with general anesthesia.
I've been on that operating table before with little to nothing other than those little spots of, what did you call it, lidocaine?
Yeah.
Mm-hmm. And it is tolerable. And you're able to communicate back and forth. You're able to watch the table cameras and know that you're receiving pain relief, the real pain relief and resolution to the problem. Not that you just kind of wake up after surgery and hope things went well.
I understand something. When I get to the bone and I expose the nerve, if I touch the nerve, the patient feels that. So it's in my benefit that the patient feels that, because then I'm not going to damage the nerve. But the point is this: general anesthesia is a really bad anesthesia. And you create a situation with too much anesthetic or so, that can affect immediately the heart rate, and you can have something that is going to take you occupied for at least an hour to try to solve the problem, if you can solve the problem. Patients sometimes, when I do surgery, they go, "Oh, I want to go to sleep," but I try to make the patient understand the same thing that I'm talking to you, to try to make you understand that that is not a good idea.
I would think least invasive is always the better route. Thank you for watching American Medicine Today. We'll talk more about that in a future episode. And if you'd like to see other episodes of American Medicine Today, add us to your favorite channel lineup.